Welcome back, everybody. Today is Medical Monday. As always, our hospital experts from East Cooper Medical Center keep us up to date on the latest medical treatments and procedures. Today, Dr. Allie McCray is here to talk to us about new screening techniques for colon cancer. Dr. McCray, thank you so much, and thank you for coming on the show. It's great to see you. Tell me a little bit about colon cancer and what age that people need to start getting screening, because that is one of the most important parts of beating this disease.
Sure. Well, for most people, screening starts at age 50. If the family has a strong history of colon cancer or their personal history of things like Crohn's disease or something like that, then screening starts earlier, and you should talk to your doctor about earlier screening. And of course, if there are any symptoms, things like bleeding or change in the stools, then we recommend a colonoscopy at any age.
Is this both men and women?
Yep, same for both.
Okay, do rates kind of vary between men and women, or can really anybody be susceptible to colon cancer?
Really, anybody is susceptible. There are certain risk factors that are starting to be delineated in the research, and certainly a genetic proponent plays a strong part, but we're still not exactly sure entirely who's at risk.
Okay, tell me about some of the different tests that are out there to help prevent colon cancer.
Well, the gold standard is a colonoscopy, which most people have heard of, a lighted camera up through the bottom. And that starts at age 50 and is usually done every 10 years until age 75 or so. The other options are a fecal occult blood test, which is a yearly test and non-invasive, and flexible sigmoidoscopy, which can be done every 5 years in conjunction with occult blood testing.
Now,
as well.
is there any kind of difference in what those tests pick up? Is there a reason why you would do that yearly one versus the 10-year one?
Well, certainly there is.
Is one more accurate than the other?
Yes. Well, the gold standard still is colonoscopy, but certainly it is invasive and requires, for most people, some sedation and some time in the hospital.
Yeah.
And many people are reluctant to get screening because they're either embarrassed or uncomfortable with the test, or they just simply can't afford it.
Right.
So fecal occult blood testing is a very non-invasive way to screen for colon cancer, and it looks for blood in the stool, which is one of the first symptoms of colon cancer.
You mentioned fear a little bit over the colonoscopy, but really it's recommended that everyone get them, as you said, at age 50. And really the test itself has it's gotten more modernized, right? I know you used to have to drink gallons and gallons of that liquid. Now it's not as bad, right?
That is one option for preparing the colon. Certainly the prep is usually the worst part.
Right.
And many people are rightly afraid of that. But there are different ways of preparing the colon now. We do have different medications that are more tolerable for the patient. And the test itself is actually very comfortable. Most patients are given a little bit of sedation, so they don't remember the test at all.
Okay, fantastic. You're going to put my medical terminology to the test right here. Who is a candidate for laparoscopic colectomy? Did I get it right?
Yes.
Okay.
So laparoscopy is a technique for removing portions of the colon, both for cancer and for non-cancerous conditions, such as diverticulitis or polyps that could be cancer. And laparoscopy is a technique for removing the colon through small incisions rather than the traditional incision down the middle. We use a lighted camera and several small incisions to remove the colon. And many people are candidates for laparoscopic colectomy. It's an evolving and relatively new, say within the last 10 years, technique. And some surgeons aren't as comfortable with it.
Sure.
So some of it is surgeon expertise. Some patients are not good candidates, including people that have had multiple surgeries on their belly before, or if they're pregnant, or sometimes people that are very obese are not good candidates for laparoscopic colectomy.
So the advantages of that, you call it LC, that would be less invasive, it would be less time in the hospital, less recovery time?
Exactly. Most people experience less pain because it's smaller incisions. There's a lower chance of hernia forming in those incisions, and a shorter hospital stay.
And doctor, if you could make a plea to everybody out there, because I know, as you said, this thing is sometimes it's embarrassing. Nobody really wants to go through this, but this can really save your life.
Absolutely.
So make sure you get tested once every 10 years, you're saying, or talk to your doctor every 2 years?
Talk to your doctor at least starting at age 50 for most people, and certainly if there's any chance or any change in the stools, things like a thinning of the stools, a smaller caliber, or if you see blood in your stools, then certainly talk to your doctor right away.
All right, very important stuff, and we thank you for being here and telling us
Thank
about
you.
it. If you want to schedule an appointment or learn more, just check out your screen right now. We've got all the information on there. It's 884-7031 or eastcoopermedicalcenter.com. Dr. McCray, thank you so much for your time.
Thank
really
you.
do appreciate it. Thank you so
Thanks.
much for being here. All right, up next, everybody, of course, you can head to our ABC News 4 page for the experts on East Cooper Medical Center as well if you want to learn more. Up next, it is time to talk prom and how you can help make it a comfortable night for some girls in need. The Cinderella Project joins us next. Stay with us.